Joining us now to discuss is the Dean of the Brown University School of Public Health, Dr. Ashish Jha. Good morning to you, Dr. Jha.
Good morning, Rachel. Thanks for having me back.
Of course, we thank you for joining us. Let's talk about it. A new study has found hundreds of thousands of Americans have sought medical care for post-COVID health issues. Now, months ago, we were told we might not know what will happen post-COVID. We might experience symptoms later on down the road as a result of getting COVID. How concerned do you think we should be?
Yeah, there are a lot of Americans who've gotten infected, and we know about long COVID, which is the set of symptoms that people have for a long time. More and more data is emerging that people who've recovered from COVID, many of them continue to suffer symptoms, neurologic symptoms, cardiac symptoms for weeks or even months after fully recovering or after recovering. So we have to pay really close attention to this.
And Dr. Jha, from your knowledge, is it anyone specific, maybe perhaps people who were already dealing with health issues prior to getting COVID, or is there any correlation right now of who's experiencing that long COVID? I mean, I know personally plenty of people who got COVID and are doing fine now and don't have those issues.
Yeah, no, so thankfully, a vast majority of people do get fully better. We don't have any really good demographic information. It's not necessarily the same people who are at high risk of complications. So it's not necessarily older people. It's not necessarily people who had other chronic diseases. We're seeing it in young people, often in younger women, but we're still really learning about this.
Right. All right, let's talk about this new variant. The CDC is calling the Delta variant the variant of concern. Do you have any expectation that we're going to experience, let's say, another uptick in cases this fall here in the United States?
I do, and I'll tell you why. What we saw in the UK is even further ahead of us in terms of vaccinations, and their case numbers have come way, way down. And then the Delta variant became dominant in the UK, and we have seen infections in the UK go up 3.5, almost fourfold. Hospitalizations are beginning to rise in the UK. And that's what I unfortunately expect will happen a little bit here. We're not going to see the surges that we saw over last winter. I think we're thankfully done with that. But I do expect some bumps in cases and maybe even a spike in case here or there, especially in areas where there aren't a lot of people who are vaccinated.
Speaking of the UK, they've been very strict on easing up their restrictions there. Many people discussing that, of course. Meanwhile, states like New York, right here in New York City, which did have very strict lockdowns, they lifted most of those restrictions with COVID-19. They had fireworks to celebrate last night. And here's New York Governor Andrew Cuomo talking about that. Let's take a quick listen.
The state mandates that have proven right and correct and brought us through this pandemic are relaxed as of today, effective immediately. I'm not giving up my hand sanitizer just yet, by the way. I love that New York Clean hand sanitizer. It keeps everything clean.
So with the variant in the UK that you were discussing, with their vaccination progress compared to here in the States, about 10% of the cases here are being said to have that Delta variant. Do you think we're rushing the reopening?
No, I wouldn't say we're rushing the reopening. What I would say is we got to do more on vaccinations. Look, infection numbers are down across the country. We've seen states like Texas and Florida reopen without any serious problems. And I think that's all good news. It means that we can reopen our country, and we should. We're at a point where we should. I think the question is, how do we keep it open? How do we avoid surges? How do we avoid having to go backwards? And there's only one way, and that's getting people vaccinated. So that's what we should be focused on right now.
And Dr. Jha, nearly 900 people received expired COVID-19 vaccine doses, we're learning, at a vaccination site in Times Square this month. What do you think that means for those people that received the expired vaccine? Do you think they should be getting another dose? Are we still learning about the vaccine and what the effects are of an expired dose? Or what do you think the correct protocol would be here?
Yeah, well, first of all, we should not be giving people expired doses. Come on, what are we doing here? So that's the first thing. Second,
you would think.
Right. Second is I'm not totally sure that the pharmaceutical companies have really figured out what it means for something to be expired and why they've set the dates. Look, they've been very conservative and they've set very aggressive dates. We need to understand, if something is a week late, does that mean it really is starting to lose its efficacy or not? That's what we need to sort out next. Obviously, if there's any evidence that things are becoming less effective because it's expired, then those people probably need an additional shot. But first of all, we should really figure out what's causing these things. Why are we putting the dates that we are on expiration? And then we should not be giving anybody anything that looks expired.
And how would we be missing that? Dr. Jha, we still have a little bit of time left. My host, Rob Finnerty, wants to jump in here real quick before we let you go.
How are you? Your good buddy Rob Finnerty here on Wake Up. I know you're in Rhode Island. I know you've been to Cape Cod before. This has nothing to do with coronavirus. Did that guy really get swallowed by a whale?
Oh, you know
no
what?
idea what you're going to ask.
I'm going to have to go with I think so. I mean, that's what he claims. And if that's what he says, I'm going to believe him. It's a bit of a crazy story, though, right?
It is an insane story. And we've tried to get him on. I've tried to get somebody from NOAA and from Woods Hole and the Oceanographic Institute. This is the story that America is talking about right now.
And you're trying to get me to fact check it, and I like it.
Yes.
I don't have any firsthand experience either with the guy or being swallowed by a whale.
Neither do we, Dr. Jha. Didn't know where we were going with that one. It made me a little nervous at first.
Had to ask.
Dr. Jha, thank you as always for joining us.
Thank you, guys. Be well.